So hello there, everyone. How are you doing this evening? It is wonderful to have you here joining me. And so as soon as I get some things rocking and rolling here, get things going. Okay, here we go. Thank you again. Thank you so much for being here. My name is Dr. Susan Plank. I have the Normal Wellness Center. And, I talked about, I have a radio show, and I talked about a little bit of the stuff we're going to talk about tonight. Could it be your thyroid? And I just wanted to say, it could be your thyroid. If you're suffering from a lot of sort of nagging symptoms, right? You're tired, the weight, digestive issues, it feels like you're constipated, and then you have to take something, and then there's skin issues, and there's hair issues, and then the fatigue is worse again. If you have all these sort of symptoms that bounce around, something is worse than something else, and then they just sort of repeat, chances are, yes, it could be your thyroid. So I want to welcome you. Thanks again so much for being here. And let's get started. I do want to say, if you have any questions, please don't hesitate. You can drop them right down in the bottom in the chat section there, and I'll try to keep an eye out for them. I like to, because as we hit certain slides or I say something, it might pop a question in your mind. I love to tackle them right away rather than wait. So please pop them in there. I'll try to pay attention, but I want to make sure I get all your questions answered. Okay, so here we go. So again, if you're living with these unexplained symptoms and you're just not sure where to go to, chances are you've gone to your doc and everything's good. Everything's good. Or, it looks pretty good. Well, let's check it again in a couple of months. This becomes the frustration of thyroid. There's a disconnect between functional nutrition, the labs, because the labs are actually the ones that set up their normal ranges, and a majority of the medical profession is going to accept those normal ranges. And so if you look for somebody that's a functional nutrition practitioner, then you're going to get sort of updated ranges that are geared towards taking into account the labs and your symptoms at the same time, not one or the other, but both at the same time. So let's start with a little anatomy. The thyroid it's the shape of a butterfly. It sits right in the front of your neck there, and it actually sits over top of your windpipe. So if you feel at the base of your neck, you're going to feel two sort of hard little bumps. If you put your finger in between, that is actually where your windpipe is. And if you go up about an inch and a half, you are going to be right on top of the thyroid. So that is exactly, see, that looks like a little butterfly there, and that's where it sits, just right in front of the throat. So what the thyroid does is it actually secretes hormones. There's a couple, two main ones, and then another one. Secretes hormones that are responsible and mostly known for our metabolism. But the thing is, thyroid receptors are on virtually every cell in the body. So that's why we can have such diverse symptoms. Again, receptors on the intestines, right, for thyroid. So it's going to control if somebody's more constipated, has more diarrhea. The hair follicles, the metabolism, so your weight, how easily you can burn off weight, how quickly you gain weight, depending on what you eat. So these are a lot of the issues that we're seeing specifically with thyroid. So again, it secretes a couple of hormones, we'll say three main hormones. And so I want to let you see here that a lot of folks are familiar with TSH, And they actually think TSH is a hormone. Actually, it's released from the pituitary in the brain to keep an eye on. It's a feedback mechanism. The actual thyroid hormones are known as T4 and T3. And there's another hormone, lesser calcitonin. It has to do with the amount of calcium in the blood. So if you're maybe aging and you have a family history, you're at greater risk of osteoporosis, osteopenia. Maybe you've already been sort of warned, hey, you have some osteopenia here or some osteoporosis. This is why, having these hormones checked can be a valuable foundational analysis of what's going on, what's causing these types of issues. So the thyroid hormones, the T4, T3, are actually made out of iodine. Iodine is a molecule that our bodies cannot make. So we have to get it, and iodine is sea, ocean, right? Salt water. So we have to consume it. And there is a wide swath of the United States. It's known as the goiter belt, right? It's the less iodine people are eating that live in there. And a goiter is an inflammation of the thyroid gland. So the T4, which is stored in the thyroid hormone, is made up of 4 iodine molecules. And so again, it's like a little butterfly shape. Once T4 is released from the thyroid, it goes out to, I use this example today on the radio. It's at this time of year, think of a tulip, right? So we have the stem and we have the bloom of the tulip. So the hormone is released, T4, and it's going to bind, it's going to sit in that tulip, right? And that hormone, what hormones do are communicators. So it's going to communicate, it's going to tell the cell that has that little tulip receptor on there what to do. Do you need to speed up? Do you need to slow down? What do you need to do differently than what you're doing? But once that hormone settles in there and starts communicating with the cell, that becomes the most active thyroid hormone, and it's now T3. So an iodine molecule gets cleaved off that T4 once it leaves the thyroid, and now it becomes T3. Okay, makes sense? So if you had an iodine issue, if you had an iodine problem, and maybe you don't even know, maybe it's never been checked, but if you've had a thyroid issue, or hey, you're on Synthroid or levothyroxine or something we have to keep an eye on, now it's very important what your iodine level is. Because if you don't have enough iodine, guess what? That's right, you guys guessed it. You cannot make enough of the T4 and T3. So then you're taking a medication you just might not need. You might need the iodine because, again, wide swath, people aren't eating iodine. We have to get it from the food. Our body cannot make it. Okay, so on we're gonna go. So again, that is the role of iodine, right? Is to make those T4 and T3 hormones. It is a mineral. So again, it's nothing else in the body can really come together to make it. Now, I know some of you might be, there's some imaging studies that you have that there's an iodine, right? That is an allergy, a sensitivity to iodine. Sometimes you have to look at the form because some people can actually do iodine, but can't do iodide. So we need a little bit more information if you happen to be one of those folks, right, that are limited, you think, in your ability to actually take iodine or suspect that you might be deficient. Okay, so let's move on to your metabolism. So your metabolism then, because like I said, all these cells have the receptors for the thyroid hormone on these cells. And so if there's not enough, now your body's going to start to slow down. Your heart rate's going to slow down. Your digestive system's going to slow down. Your brain, your thoughts are going to slow down. you're going to be sort of more depressed, right? Your thought process is just going to be more sluggish. Maybe, some folks I talk to, they do describe it as depression. Other folks describe it as being unmotivated, right? Some folks, they don't even sweat anymore, right? They can't tell me the last time that they broke a sweat. The skin becomes sort of pale and thin. The hair becomes thin and brittle. There's a lot of joint pain and muscle aches, and the face tends to get puffy, and the voice, right? The voice can even start to go hoarse. So again, we're looking at virtually every organ of the body is going to slow down when we don't have enough of these thyroid hormones. So we have to look at, right, the whole reason of what is going on, because that very simple mechanism I explained to you of the iodine and the T4 and the T3, right? And the little tulip, right? It sounds so simple, but with every step of that process, we can have something go wrong. And that's what starts to get us into trouble. So the thyroid is just one of many hormones in our body, and that is known as our endocrine system. Now, there is some very exciting research coming out. And let me just preface it by saying that the hormones, all of our hormones interact with each other. We don't necessarily have a hormone in our body that it can go haywire and it's not going to affect something else. Sooner or later, it will. And so that is really troubling to me when it takes longer for folks to get diagnosed, right? The symptoms have to sometimes get so profound because, again, the medical profession is using outdated lab ranges, or you might have a doc that just doesn't, like, when have you ever had your eye done, right? You might be taking, like I said, Synthroid, levothyroxine, Armour Thyroid. You might be taking one of those, but do you ever have your iodine level checked? So the other really important fact here is that, and we're going to get into it more in just a second, but the thyroid interacts with our immune system, as do our adrenal hormones, cortisol and DHEA. And I'll tell you, the reaction of the cortisol is one of the most profound, and it's this breaking research that as cortisol, which is driven by stress, it's also known as the belly fat hormone. So as the cortisol rises, and if the person doesn't realize it or they just don't even know what to do, yeah, I feel stressed out, but what do I do about it? We start to see these other mechanisms now. The higher the cortisol goes, it's actually kicking in what's called reverse T3. So just how I just got done saying that T3 is the most potent, baby. You want that T3 going into that tulip and talking to your cells because it gives you the energy you need. But if you're stressed out, if you're under stress, and we've had a lot of stress here, right? In the last couple of years. And even now, the news, social media, everything is just sort of bombarding us with not very pleasant sights. So the more you're stressed out, if you're having trouble sleeping and that cortisol is really surging for you, it might be a time of day, it might be the whole day, it might be kicking in at night if you're on your phone before you go to bed. The higher that cortisol goes is now taking the active T3 that needs to talk to your cells, and it's, boom, reverse T3, and it's shutting your whole metabolism down. Okay. So again, it's very, very important now. If someone really feels like, hey, I have a lot of these symptoms, of thyroid, but I can't get somebody to listen to my symptoms and the test doesn't come back the way I think the test is going to. We might need to look at more than just a TSH, right? We need to get more specific information on the labs to figure out exactly what's going on. And so I really am a fan of not just testing thyroid by itself, but I'll check a lot of the other hormones as well. So cortisol and DHEA. So I hope that makes sense. If not, please pop a question down there in the chat, because I want to make sure that this makes sense for you, because this is a lot of folks are experiencing these types of things. Okay. All right. So we're going to be moving on here to the immune system. So this again is where my take is a little bit different. The thyroid interacts with our immune system, right? The thyroid is allowing, it sort of gives our immune system energy too, right? Those cells. But now what happens is if there's a problem, say we have somebody that has a food intolerance. I can't eat dairy. I'm lactose intolerant, or I think I'm sensitive to gluten. Or maybe a family history of rheumatoid arthritis. Maybe we already know there's some type of inflammation going on. That's the tricky part about inflammation, folks. It usually starts with the digestive system, and folks start taking antacids, right, to try to knock down. They're prescribed by the doc. Hey, we need to find out what food you're sensitive to. You can try and squash the inflammation locally, but that's the part about inflammation. It gets deeper and deeper into the body. So it goes from digestive system to endocrine system to blood vessels and heart, right? Heart valves, brain, neurological, joints. It's getting deeper in the body. What that means is if we already know someone that has an autoimmune disorder, that immune system is on high alert. It's on high gear, and it's pumping out what are known as antibodies. The antibodies are immune system's way of sending out sort of little soldiers to go fight what it thinks is the bad bug, right? The virus, the bacteria, whatever it is. And you're hearing this a lot now with folks that have COVID. They're calling it long COVID, because their body's just wiped out and their immune system keeps getting triggered, right? Their immune system is hyperdrive. And it's just wearing them out because it takes a lot of energy. But when these antibodies turn now and go and attack either the little butterfly thyroid or the tulip receptor, we're now going to have this whole thyroid metabolism combination. It really starts to go haywire. And this is, again, a point that I want to stress to you, where my approach is sort of different than the straight classic medical approach, is we have to identify then the inflammation. We have to find out what is causing inflammation. Virtually 99% is some type of food, but we can have virtually anything that we're taking into the body. Is it toxins? Is it pesticides? You don't wash an apple, right? Is it too much alcohol? We have to start to look at our diet as the source, one of the primary sources of inflammation. And then the immune system creates these antibodies, and it matters where these antibodies attack. When this happens, this is known as Hashimotos. Right? We're gonna get more on that in a little bit, but it's Hashimoto's thyroiditis, inflammation, thyroiditis, inflammation of the thyroid. And so what's happening then is the inflammation is causing destruction of the thyroid, or affecting the receptor, destruction of the receptor. It's changing their function. It's changing the ability of the hormone to be released, to get carried where it needs to dock where it needs to in the receptor. At any point in this process, and it's a very intricate process, inflammation can sort of come in and hijack that process. So then my point of telling you this is, is if you've been told, if you've been diagnosed, if you've been told you have Hashimoto's, the next step is, where is the inflammation coming from? Because otherwise with Hashimoto's, they are chalking it up to, well, that's the number one cause of thyroid disorders in the United States. But like I just said, Hashimoto's is actually inflammation. And so we have some folks that we can check their thyroid hormones, and they're pretty much close to the optimal range, my optimal range anyway. So what's happened is the destruction from the inflammation hasn't gotten far enough, right? It hasn't been going on long enough that it's actually destroyed the thyroid or the receptor. And if we reverse that inflammation, we can actually have somebody not need medication, right? Not have the side effects from medication. And isn't that the ideal way about it? So again, just because you might have been told you had Hashimoto's and they put you on one of the medications that I said, it doesn't mean that destruction to your thyroid and those receptors isn't still ongoing. It just means they put hormone in to try to give you more of a boost. So I hope that makes sense for you. Okay. So we covered sort of how it feels to be under thyroid, right? We're going to get into that too. But the overactive thyroid, boy, these folks really, really, really suffer. A lot of anxiety because now their body's really hepped up. Their body's really, really on hyperdrive. Sleep is difficult. Digestion, it's a sort of things moving through very quickly, a lot of diarrhea. Sometimes their metabolism is ramped up so much that now they're becoming nutrient deficient. They can't keep all the nutrients. They can't eat enough. That's how fast your metabolism. I know you might be sitting there going, "Oh, I wish I had that problem," but no, you really don't. It's a tough problem, right? It's a tough problem. And again, it is inflammation driven, but now we have too much of the hormones being produced, right? And so that person is really just feeling stressed out. And ultimately, long term, it can affect the eyes. Yeah, I think there's a lot of commercials now you're seeing for eye medication because the eyes can start to bulge, which is very dangerous because the eyelids then cannot close over the eyes. So these people really do and can have a lot of symptoms that are really very uncomfortable. So again, that's when they have too much of T3 and T4. So too little of the T3 and T4. And let me just sort of clarify. So if you have a doc that only likes to do the TSH, remember what I said, TSH is actually being released from the pituitary in the brain that's telling us how the thyroid is acting. So an abnormal TSH is as it goes higher. Ideally, I like to see a TSH between 1 and 3. Everybody sort of has this little optimal range, but as sort of a general screening type of thing, I like to see it between 1 and 3. So the TSH can go higher, and if the T3 and T4 then go lower, that is the classic pattern of an underactive thyroid. And with that, we're going to see really, like I said, the fatigue, the just sort of feeling depressed, unmotivated. Folks just say, "Oh, I feel like such a couch potato. I just don't want to get up and do anything." You just can't get going in the morning. You can't feel like, you feel like you can't get your brain turned on. So, it's very common for folks that then are hypothyroid, meaning low thyroid, that are reaching for more and more coffee, more and more caffeine, more and more stimulants. And it might be sugar. Like I said, it might be caffeine. If they're a smoker, it might be nicotine, anything that they can take to sort of give themselves a boost of energy, give themselves some mental power. And again, these symptoms start out sort of slow and minor, But the longer the person goes on undiagnosed, they're really, it can really be a profound effect on someone's life. So the hair, the nails, we're going to see a lot of the skin gets thinner, and just the person is really struggling. Again, their whole body is struggling. So does your neck ever feel swollen? Absolutely. Again, remember what I said? The thyroid sits right in front of the windpipe. Behind the windpipe, we're going to have the esophagus. The more swollen this is, so again, a goiter is an inflammation. And so we tend to think, well, it's going to sort of poof out. But if it happens to be the back side of the butterfly that starts to press in, yeah, it can get pretty uncomfortable. Difficulty swallowing, sort of a wheezing or almost an asthma, especially on exertion. If the person's trying to breathe heavy and they have this pressure, right? They can't get enough oxygen in. It puts a lot of pressure on those underlying structures. So it can start off with like a stiff neck, not feeling quite right. If you look at somebody and you see the creases we sort of normally have in our neck, the horizontal creases. Sometimes you'll see some TV personalities, and there's a few there that it almost feels like, looks like the skin is sort of bulging. Those creases are really getting profound rather than the skin is sort of relaxed. That's somebody that has some underlying inflammation in their thyroid. So how are these thyroid issues, how are they typically diagnosed? And again, ideally it is with labs, and more so, I should say, ideally more so than just the TSH. Unfortunately, only doing the TSH is really pretty old school medically right now. But I hate to say it, I see it all the time on like a weekly basis when I'm reviewing labs. You'll get labs sent in from providers all across the country for me to take a look at. And it's truly amazing still that folks have all these complaints of all these symptoms of thyroid, and yet the doc only ordered a TSH. So I like to do the iodine. I like to get a level on the where the iodine is. Hopefully it's in a normal range, but it's better to know, because it's a simple fix and we can really get folks off meds, or hopefully not even need them if we can get things like that balanced. I want to see the T4, both total and free. I want to see the T3, total and free. I do the tests for the autoimmune disorder, the Hashimotos for the thyroid, and also for the receptors. I do those testing pretty regularly because, again, the number of times it's probably close to 50% that the person's hormones are normal, and yet all these symptoms are coming from inflammation. And if they happen to not come to me, but go to another doc, and they only did the TSH, which looked normal, and they didn't do any other tests for inflammation, that poor person would be put on hormones, and the inflammation would never be addressed. It would just never be tackled. So it's a big reason, the not using all of these lab tests that are at our disposal. Again, it's going to be hard pressed nowadays to find somebody doing the reverse T3. I can say that's not necessarily one I order on everyone. Insurance companies really don't like to pay for all these tests. We're going to see that more and more so. But if I suspect, if I see those antibodies off, by all means, we can go back and do the reverse T3 to see, is that what's happening? Or I usually end up, I usually am doing the cortisol, the adrenal hormones at the same time I'm doing the typical thyroid panel. So that is a big reason why I don't necessarily have to go back frequently to do that reverse T3. But you want to be able to have a physician that is taking your symptoms and listening to you. There's nothing worse then finding a professional that you're talking to, you're telling them how you're feeling, and they're looking down at the pad, or they turn around and walk out of the room when you're like mid-sentence. And so we need a way for you to really have your symptoms listened to, and that those docs are doing the testing. I hope this is coming in the near future. We're just not, unfortunately, we're not there quite yet. So again, lab tests to ask for. If you have any of those symptoms that I said about, now again, hypo, meaning low thyroid, is much more prevalent. So if you're tired, if you're fatigued, cold hands and feet, that's another big one. Cold hands and feet coming out of winter, even now with chilly days. You're gaining weight easily, you can't lose it, and it seems like it's just sort of ramping up. You're gaining more and more weight faster and faster. You no matter how little calories you're eating, you just can't lose it. Very thin skin, the hair, nails are breaking very easily. And sort of, I call it foggy headed. Your brain just doesn't feel like it's kicking on, and you're unmotivated. Definitely what we want to see: TSH, iodine. These are all done on blood. They're all done on blood. TSH, iodine, T4 total, T3 total, T4 free, T3 free. What that means, the free, is that they're not bound. So when that T4 is moving from the butterfly to go to the tulip, from the gland to make it to the receptor, its hormones are moved by what are known as carrier proteins. And so, we have to, it's very important to know how much total of the hormone do we have, and then how much of it is actually free that can bind to the receptor. If you have, a lot of hormone, but it's all bound, there's nothing left then that can attach to the receptors, and the person's going to feel sluggish. They're not going to feel great if this happens. So, start to pay attention to these things. And again, they're symptoms that can be very prevalent, and they can sort of ebb and flow, right? But if you're noticing that over time, any of these symptoms are just getting worse, it's definitely time. It's definitely time. You can get away with sort of the ebb and flow initially with maybe one or two of the TSH and maybe a free T3 or something. But if you get into having these symptoms much more consistently, by all means, you need a full, and I mean a full thyroid panel. And the Hashimoto's antibodies, those should be done. And again, so if it's somebody that's more sluggish, those would be the tests. We would start if somebody's more anxious and potentially a family history of what's known as Graves' disease, which is a hyperthyroid. Still, typically we start with those, but we might add in a TSI, which is a test to check for Graves' disease and hyperactivity of the thyroid. So again, we talked quite a bit about Hashimoto's, and I just want to say just a couple more words on it. I really want you to look at it, Hashimoto's, as not necessarily a thyroid hormone issue. And that might be shocking, because you might be listening to this saying, well, I was diagnosed with Hashimoto's and I am taking Synthroid or one of the others. And all I can tell you is, depending on how long the inflammation has gone, you might not need that medication. That medication, they're giving you thyroid hormone, and Hashimoto's is an inflammatory. It's going after the thyroid. It's going after the receptor. You have to destroy a lot of the thyroid gland to really knock out the hormones being produced. So chances are there might be some other reason. And my goal always is, can we do things as naturally as possible? Because you're going to then be able to get back to sort of a normal rhythm of life, right? The digestion works, your sleep is on, everything's sort of working in balance. And that honestly is very, very hard to do with medications, even though the lab results, the doctor might say, oh yeah, that is beautiful TSH results, and yet you still feel like, it's a struggle to make it through the day. So we have to look at incorporating the symptoms with the labs to get the best information. So again, Graves' disease is when it's hyper, there's a lot, right? So the TSH level is going to be lower, but those hormones T3 and T4 are going to be higher. And so that metabolism is really fired up. It's chugging along, and it's chugging along 24/7. So where somebody hypothyroid is going to struggle to get out of bed, the person hyperthyroid, they're like the ever-ready bunny. They're going to keep going until, like I said, their body just drops. And it's usually because they're so fatigued, or like I said, we have to really watch with nutritional deficiencies, for those folks, because it's hard. They want to eat a lot, but they can eat a lot and still not gain weight because they're just supplying what's being burned. Now, I do want to sort of backtrack a little bit and mention, just because I mentioned about iodine, I don't want you to just think you can start taking iodine and it's going to be ideal. It's not. If you don't need it, you shouldn't take it. And the reason I'm bringing this up is because Graves can be kicked in, and the Graves disease sort of like symptoms, that hyperthyroid, that hyped up metabolism, those symptoms can be kicked in, the anxiety, the diarrhea, all that stuff, heart pounding out of your chest, if you take too much iodine. So again, maybe you just happen upon this webinar, and you're working with another nutritionist. Please make sure they're doing the labs. Please make sure they're checking your symptoms. We've got to keep an eye on this, folks. Just because it's natural doesn't mean we can't really shift things and cause some problems. So you really want to pick a healthcare provider, a nutritionist, a functional physician that's been around the track, right, and knows what to look for and does some labs. So honestly, the big thing for supporting thyroid is like we're supporting any part of our body. It's let's look at eating well. Let's look at good sleep. Let's look at get moving, right? You got to carve out time in your day for these things. You just have to. I know life is hectic, and in some ways it feels like we all have devices and we have no time. The more devices we have, the less time we have. But I ask you to sort of take a hard look of what you're making important in your life, because if you want to sort of reclaim your health, you want to get back to feeling good, you want your energy back, you want to lose a few pounds. All these very important lifestyle changes are there to also support your thyroid as well. So, and again, like I said, stress. We want to look at what those cortisol levels are. You can pretty much tell if somebody has all the weight sort of sitting in their belly, and they have sort of like little chicken legs, these little skinny legs, but they're big up here. I always worry about insulin resistance, but also cortisol, too much cortisol and stress, physically or emotionally. So again, you want to support your adrenal glands. Are you getting good sleep? Are you eating well? I'll tell you, the folks I worry about when I'm talking to somebody, see if they're a good fit for a program. Have you suffered a loss? Have you had in life sort of this a big loss. Like you maybe someone passed away, a relationship, and did you really struggle to get past that? Is it sort of you just felt like you never got past that loss? Those are the folks I really, really worry about for their adrenals and the stress hormones. And then also too, like I said, the effects we're seeing of how those interplay with thyroid. Loss in any form. It could be you think you have the best job, you love your job, or you loved your job. And now with things that have transpired, you no longer have that job. These big stressors take a toll. And again, as those hormones, those stress hormones get affected, we're going to see it reverberate throughout the whole body and absolutely affect thyroid hormones. So I wanted to sort of throw this out here for you guys that I am coming up in April. I'm doing a 6-week wellness and weight loss breakthrough session, right? So it's just like, hey, it's spring. It's I just want to feel better. I'm tired of living in the house or, watching Netflix or whatever it is. It's time, right? It's time to eat healthy. It's time to, let's get it done. So, our deadline to get a discounted price on that program is today. And I am not a hardcore, hey, you got to buy now type of, provider. It's just not I'm not salesy. But what I do want you to do is, if you're even remotely interested in finding out about any labs or, potentially taking advantage of this 6-week program, it is actually has a bonus with it. So not only do you get labs and its programs discounted, but you actually get an additional 28 days a month. And we're going after inflammation, right? So it's ideal for somebody that's been diagnosed with Hashimotos. It's ideal for somebody with any other type of autoimmune disorder. It's ideal if you have knee pain and low back pain and digestive, like you eat something and you just can't stand it, right? Any type of migraine headaches or inflammation. Irregular menstrual cycle is caused by inflammation. So, it's an ideal time if you really want to take advantage of it. What I want you to do is go to my website, Norwin Wellness, and through midnight, you're going to see this red button here that says click here. If you want more energy and to lose weight, I want to break through now. This is exactly what my website looks like. You're going to see this big red button. Please click that button. And there's a couple of questions there. Fill out the questions, and I will do my best I ask you if you're interested, give me your best phone number and a time of day when I can contact you. I'm going to try to get all these calls done this week, but I already have, because the deadline is coming, ends tonight at midnight. I already have, my schedule is sort of full with trying to talk with folks. But if you complete that form, definitely I will talk to you and we'll still sort of pass on that discount and the chance to do the labs. If that doesn't interest you, we're still doing a 6-week sort of eating plan, right? Where we're going to clean up the eating, and we're going to do diet logging, and we're still going to give you recipes and shopping lists and weekly Q&As. We're doing that. But the folks that are really motivated to find out more about their health and to make changes, and like I said, more energy, lose some weight, just ready to just grab life back again, right? Just motivated to do it. I really recommend you head over norwinwellness.com, click that red button, and get that filled in before midnight tonight. So, okay, there we go. Thank you. And let's see, do we have any questions? Do we have anything? Nope. All right. Well, I must have done a really good job explaining. That's a little hard to believe, but so folks, thank you so much for being here. I really appreciate it. Hope you found it informative. Love to see you as part of the program. We're already having fun. we're gonna have some more fun. But however I can help you out, please don't hesitate. Visit normanwellness.com, reach out, and let me know what's going on, how I can help, and please take advantage of a free 15-minute. What's your best next step to get where you want to go? So thanks so much, everybody. Take care and have a great night. Bye.